Hello, and thank you so much for being willing to be tested to see if you were a match for a leukemia patient. I spoke with the patient, and she is so grateful for all of you. My purpose here is to inform you about the procedure that will be done. Now, bone marrow aspiration is a simple procedure, so let's break it down. Bone marrow itself is a very important component in our bodies because it creates our red blood cells, our white blood cells, and our platelets. The preparation of the donor patient is quite simple. The patient will lie on their stomach, and only when they're comfortable will the doctor begin. The beginning of the procedure starts when the doctor cleans the area on the lower back of the patient, because the typical bone marrow collecting area is the back of the hip bone. The doctor will then administer a local anesthetic so the patient feels nothing. The doctor will then insert a sterilized hollow needle into the hip bone. A sample of the liquid marrow is drawn into the needle, and this is the aspiration. It is normal to feel a pulling or drawing sensation down the leg. The whole procedure normally takes about 3 to 7 minutes for the aspiration alone. After the liquid marrow is drawn, the doctor pulls out the hollow needle and gently applies a bandage on the draw site. Most patients report that the pain immediately disappears, but it is uncomfortable to stand for about 10 minutes. The recovery for this procedure is quick and only lasts 3 days, if that. Simple painkillers, such as ibuprofen, are suggested if it is uncomfortable to stand or move. The bone marrow aspiration is then administered to the recipient to boost their blood creation and bone health. This can be life-saving for most recipients. That concludes the information about bone marrow aspiration. I hope that you choose to get tested as a possible donor and possibly help our leukemia patient. Thank you so much for your time. Now, as an afternote, I'm sorry, Mrs. Lake, but I am sick, so my eyeballs are swollen, so I apologize if I look a little odd. Thank you for listening to my speech.